Okay, so I'm going to be performing a urinary catheter. Because I don't have an assistant with me today, it's a little tricky figuring out how to keep things sterile. So I'm going to do my best. But okay, so this is my instrument that is in a sterile pouch. I would open up the pouch and place it right there in front of the birthing person and their vulva, remaining on a sterile field. Then normally, so this is sterile. This is my sterile field. Normally I would put on my sterile gloves and then have an assistant open this, but because I don't have one today, I'm going to open this and plop it out onto my sterile field. You will need 3 pieces of gauze. There's 1. I don't want to touch the gauze because I want to let it remain sterile. So just be careful as you're opening things that you're not touching anything on the inside. I'm putting everything right onto my sterile field so nothing will be contaminated. Yes? Yes? Sorry. Yes, in 1 minute, honey, okay? Okay, so next I would, what would I do next? Sorry, I'm just trying to keep things. Next, I would open my urinary catheter so that is ready to go. I've never seen one in a pouch like this, so here we go. Never seen one in a double wrapping. So I would take this out. I would leave it like that. Sorry, you can't see. Here's my sterile catheter. This is still on the sterile field. This is all a sterile field. And this is still in the wrapping. I would also put gel right there so that the catheter can slide in easy. And then next I'm going to open up my gloves. Wow, what is happening? There we go. Sorry. If you don't have a kit, we use, if you don't have a little kit, we use this little thing to put our iodine in. So I would place that there. And I'm going to, after I wash my hands, I'm going to put on my sterile gloves. 1 second. Pretend I didn't do that. Okay. Again, I don't have an assistant. So normally I would put on my gloves and then my assistant would pour my iodine, but I don't have an assistant. So I'm going to pour my iodine into this little pouch right there. And then I can put on my gloves. And once I put on my gloves, then everything is sterile, so I'm free to touch everything. Okay, I'm sterile and I have my gloves on. Okay, so the first thing I would do is I would pick up my sterile instruments remaining on the sterile field. I would grab my gauze like this. I would dip it into my iodine like this. And then I would separate the labias and then I would go down one side like that. You can drop that. Grab your next gauze and go right down the center. And then grab your next gauze and go right down the other side. While you're doing this, I only poured a little bit of iodine, but you really want this to be pretty saturated to make sure that everything is clean. So once I do that, everything is clean on the birthing person's body, and then I can open up the labia minora and I can visualize. So usually it's at the top, it's a little tiny triangle. So I can visualize that at the top, and I can see, okay, there it is. When I open things up, there it is, and that's where I'm going to be going to place my catheter. So I have my catheter here, so it comes out of this. An assistant will pull everything off, so I'm not touching anything. But I don't have an assistant, so you want to make sure that this isn't flying all around. And then I would have lubricant that I would be dipping this into, remaining on my sterile field. I would come over like this. I would open up the labia minora, and then I would find the hole, and then I'm going to go all the way in until urine starts coming out. This end is going to be placed into a bowl so that we can measure how much urine we got out, and then we wait for everything to come out. We sometimes will have the birthing person kind of move around. We might have them lift up their hips a little bit, or just like change the arch in their back. We might push this a little bit more forward to ensure that we got all the urine. And then when everything has come out, we are we are doing a straight cap, so we're not leaving it in. If you were to leave it in, you would have tested the balloon before you inserted the catheter to make sure that there was no what's it called? No, I want to say malfunction. I don't think that's the right word, but you know what I mean. There was no mishaps with the balloon, that it inflates normal. And then you would insert it without the balloon, and then you would insert the balloon so it stays in. We do not do that in the home birth setting. We do a straight cath, and then we remove it right away. So after all the urine has come out, you're going to remove it quickly, and then that is it. The birthing person is free to move around. The biggest thing is really to ensure that you can locate the urethra and that you are maintaining your sterile field. The sterile field is easier to do when you have an assistant. When you don't have an assistant, it can be a little tricky, which you don't always do at births. So ensuring that I have everything set up and everything is remaining sterile before I put on my gloves and before I start examining the vulva is really, really important. And then just making sure that I can visualize it. It can be a little tricky when things are swollen or they have a urethra that's more set back. It can be a little bit harder to find. So having them put their hands under their fists to tilt their pelvis up so you can get a better visual, making sure you have an assistant or the partner there to hold a flashlight can be really beneficial. And yeah, I think those are all the things.